Hello and welcome to the first podcast, part one. My name is Ishan,
And I'm Meg.
and we are both extremely excited to be doing this and sharing medical and scientific information with you.
So, over the past few months, we have, as many of you probably have, been quarantining due to the coronavirus pandemic. We were talking a couple of weeks ago about something we could do to be more aware about the global situation. And the idea of a podcast came to mind and became really appealing as we ourselves could become more educated as well as educate others in the process. We want this podcast, however, to not only focus on the pandemic, our overall goal is to connect ideas that interest us with teens everywhere. We want to not only talk about the current situation, but other ideas as well. If there are any specific topics that any of you would like to hear about in upcoming episodes, please let us know in the comment section below, or you can email it to us. Our email will be in the description.
Today we are going to be talking about the current COVID-19 pandemic that has put America as well as other countries such as Great Britain under quarantine since the middle of March. We are joined by Dr. Divya Stacker, who is a general practitioner in England. As we all know, COVID-19 emerged at the end of 2019 in the Chinese province of Wuhan. Over the past few months, the virus has spread and turned into a global pandemic. The severity of the virus has been fluctuating, and as a result of the different virus characteristics and public response in terms of social distancing.
So, Dr. Thacker, we were looking into a little bit of the whole England situation, and we found a couple of numbers. So we were looking at total of number of confirmed cases as well as death toll. We found that approximately there have been 273,000 confirmed cases, as well as a total death toll of 38,000 approximately. We were also looking into a lot of the hotspot places and found that UK is currently one of the hotspots of the pandemic. And despite the leveling off in several other surrounding European countries, Britain's case count has continued to escalate over the past few weeks. Do you have any opinions or a perspective on how everything is occurring?
Wow, it's a deep question. Meg, no, thank you for that question. I think it's an interesting question, and I think you've got to take it in perspective. I think the first thing to do is if you look at where the UK has gone with its policy, I think it's been very difficult, and with hindsight, you can say a lot of things. And I think the difficulty you got here is that you've got a disease that initially we don't know a lot about. It's worked in a very unpredicted way. So if I talk to my hospital colleagues, the first thing they actually say, they've never seen anything like it. But at the same time, you've got the other end of the spectrum where you've got children who've had coronavirus being cleared, then a few weeks later are developing an unknown or odd symptom. So I think the first issue is whoever's been making these decisions, a lot of these decisions, these policies are politically led with some sort of medical advice. And I think if you look at the figures in relationship to other parts of the world, I think you have to do two things. I think the first thing, there's no question of blame, but actually looking at this, you have to ask why these figures are so different from other parts of the world. And the first thing I'd probably reflect as a GP living here, actually these figures are a lot higher than we would like. And I think what we could do in our discussion as we go along is to work out why we think these figures are different. But my bottom line here is I think maybe too little was done too late, and the mechanism that actually took place was flawed. And I don't think that was intentional, but I think looking backwards, that's what we're going to find. I think in relationship to that question that you've actually asked, I think these are the sorts of things that we need to be looking at and learning from, and actually looking at how we move from there. But the answer is yes, when you look at the figures, I think you have to judge things by results. And you compare us to, let's say, other parts of the world, let's say New Zealand, Germany, and other parts of Europe. Actually, the rate in the UK is a lot higher than we would expect.
Yeah.
Now, we can discuss that now, we can discuss that a bit later on. You tell me how, we'll go through that in terms of, I think, there's some things in the UK that went very well, and there's some things in the UK that have not gone well. And I think we have to look at both of those in perspective. And you know, as I said, what we can do is I'm happy to touch on what my feel is the perspective on this. And again, I'll make it clear this is my personal perspective as a GP, having been on the front line, actually seeing patients from that point of view.
Yeah.
Does that answer most of that for now?
Yes, that was perfect. Thank you.
Thank you.
All right. So, have you felt a sense of unity from the public when it comes to supporting healthcare workers?
Yeah, I think, taking a step back, the actual way the public have treated us as healthcare professionals has been fantastic.
Yeah.
It's the humility from our end would be that actually then recognizing what people have had to go through, and especially the front line, when you look at the people that are going in to work day in and day out and actually putting themselves at risk, and especially in the context of what was going on in the UK at the very beginning with the lack of appropriate, what they felt was appropriate PPE, not having that support. So the support from the public has been superb. They've been fantastic. We've got situation in the UK where lots of people have even volunteered their services. So that you cannot take away. And actually, even as a GP, the change I've seen from my patients in terms of how we're practicing has been great. They've always been fantastic to me, but I've had the call saying, oh, how are you? What's going on? And all these things have been brilliant. And even the public looking after the public has been fantastic as well. And I think in the UK, you probably know we have this sort of weekly clap, which
Yeah.
is people go out and applaud in the streets and they're recognized. So again, it's just recognizing that people have been great to us, and you've got to appreciate what they've done. It's like we're all in it together,
Yeah.
and that support has been fantastic.
That's great. I actually didn't know about that clapping out thing, but I think that's a great idea.
Yeah, they do it, and it's happened, I think, for 10 weeks. It's coming to an
Wow.
end now because there's things that they're looking at. But what they do, they go on the streets and you literally walk out the streets and people are just clapping and applauding, just really for the work that people have been putting into the front
That's
line, which
awesome.
is beautiful, yeah.
So our next question was, what compared to other countries has England been doing differently to prevent further transmission of coronavirus?
Okay, so I'll go back to the original question that you asked, and it relates to the spread. I think most countries have a set number of things that they can do. So you're looking at isolating people, you're looking at tracing, you're looking at testing, and you're looking at treating. And I think what we have done differently is we've effectively done the same thing as everyone else, but the timing and the way in which it's being delivered and the extent to which it's being delivered has been different. So I think that's what you've got to look at. And I think if you look at the WHO, the World Health Organization, one of the first things they came out with was test, 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 test.
Yeah.
So they wanted us to test, and they wanted us to test, isolate the people that have got the problem, then actually contact trace, which means actually look around at the people that have been in touch with the person that's got the risk, and then contact them and then treat them. So to an extent, we started very early in that in January with Germany. So the interesting thing here is we started with Germany. Then if you look at mid-March, I think Germany were doing like 600 per million of their population they were testing. These were people in the community, and we were doing about 100. Then all of a sudden, I think, if I'm not wrong, about mid-March 16, the government just stopped doing it. And I think that's one thing that we shouldn't have done retrospectively. And now they're actually reintroducing it. So that's one thing that you do. So we did the contact tracing, but I think we started off doing it, but actually we didn't trace the people. And I think that's where one of the glitches went. And I think a lot of that is related to what the political and medical advice was at that time, but also partly resources as well. The other thing that we've also done is isolation. I think we've all done that in different countries to different extents. The first thing you do is you stop the flights coming in.
Yeah.
And at one point, you stop larger groups gathering together in groups of 100. Then you go down smaller. Then you actually isolate, and you have the lockdown. So at one point in March, I think 23rd or 26th, we can check the dates. But actually, we had a lockdown where people are isolated to their homes and key workers were going out. So I think we've done this, and retrospectively looking back, I think the timing of these things were important. So these are the things that we've done. And in terms of preparing for the hospitals, what we've also done within hospitals, they've geared up their training. They've brought the junior doctors in early. They've made efforts to make more ventilators. And that's in the hospital environment. But in general practice environment, what we did very early on, we switched from talking to patients and getting them face to face to doing what we call a telephone triage. If anyone wanted to contact us, the system again here is very different from the US. Any person that has medical problems, their first port of call is their GP. So every single patient in this country has a GP that they're registered with. So we supply them with all their repeat medications, we monitor all their chronic diseases. So all the chronic things in the background, you know, the blood pressures, the diabetes, the cancers, the rheumatoid arthritis still have to carry on. So we put the infrastructure in for that in a way that we didn't have to see people face to face. We introduced video consultations very early, and now we've even gone to the fact that actually as a GP practice, our first point of call is actually email consultations. So we've probably done in the last 2 months what we were probably going to do in about 4 or 5 years. So lots of things have happened. And I think some of those, in terms of the hospital changes and these changes, are the positive things. The other thing that you also do to try and stop the spread of the problem is actually provide protection for your staff that are working in the front line. And one of the areas that maybe we can touch on later is that one area that maybe got protection, I think, a lot later in this country were the care homes, which is where the elderly are sitting and being isolated. And I think that's, again, another ditch that we need to look at. But in terms of the positives, they had policies, but I think the timing of them could have been changed.
Yeah, that's a good answer.
Okay.
Yeah, that was great. I thought that was really interesting. And I think something that has been surfacing globally is the idea of expediting certain aspects like the junior physicians and stuff like that. I think in the US, they've been doing that as well.
Oh, fantastic. Good. So,
All right, so our next question.
similar things have you to say.
Yeah. So our next question is, if you had been given significant warning about the pandemic, how would you prepare differently or handled it differently?
I think in hindsight, it's always great. You know, on a YouTube video, I can say this is what I think, and this is what could have happened. But really, I think the hindsight, as I said, one statement that I made was that if I look at the BMJ, which is like our British Medical Journal, one of the editorials say too little, too late, and too flawed. And it wasn't meant as a criticism, but it's actually meant as a reality check, because I think we have to look at the fact that our cases are higher than other parts of the world. So if I look back, I think what could have been done better was actually this contact tracing and testing earlier on. The countries that seem to have done very well were doing more tests in the community, whereas Britain stopped very early, stopping tests in the community and just did them in the hospital. Whereas now they're reversing those things. So I think that's the first thing. The second thing you should have done around that was really the contact tracing. So you're trying to stop the problem before it gets too big. So if you've got one person that can affect 5 or 6 people, if you can actually stop it where one person maybe affects one person, then you get that person and you stop it there, it makes a big difference. But if you've got one affecting 5, then you've got 6 people affected, those 5 affecting another 5, then that goes to 25, and the numbers multiply exponentially very quickly. So I think the first thing would have been a sensible contact tracing policy. We actually had a window of opportunity in time. In the UK, we were sitting and we were looking at Italy. Italy was about 2 or 3 weeks ahead of us, and we could actually see the figures, as in ourselves as doctors, that wow, Italy is going from here to here to here to here to here. And what are we doing? And the other thing I think we did late as a country, again, is the fact that we were still having social events where people were gathering. I think they had some Cheltenham Racing Festival, which was actually gathering when Italy was hitting its peak. And as a country, we were still mixing and allowing that spread of the disease to happen. So you had that as well. The difficulty you've got here is a lot of people have no symptoms and they're spreading. And we don't also understand how we can deal with that. But the contact tracing will help the ones that have got symptoms and trace those. So I think the question really is about the timing of the isolation and how rapidly it took place, and also the contact tracing. The other big area I think we needed to look at was actually, I think to an extent, we let down our elderly in the homes. And it's very painful for me to say that, but I'm just saying this as a retrospective decision, not as a decision maker, but in terms of how we look at it. I remember a situation where we were very early into the problem, and hospitals were jam-packed and they were full. And we had one situation where in Hillingdon, they had 5 patients that came from nursing homes that went to the hospital but were turned back with COVID-like symptoms. And again, for us, that is, when I heard that, that was, you know, it's very hard to handle from this end. And these are very personal things. This is all on YouTube, but these are all personal things. It's very hard. So I think what could have been dealt with differently was that when people are in hospital, when they were coming out, I think there should have been a duty of care to actually test these patients to make sure that they haven't got COVID. Because if you're in hospital, you're coming back home, and you've got COVID, actually you don't want to spread it into a closed environment. That's one thing I think could be done differently. And actually, what the other thing that should have been done a bit more earlier, I think, is actually protection in terms of appropriate PPE and testing for staff that were working in these areas. So that's if you look at the worst case scenario. But at the same time, lots of good things have happened, lots of hard work has happened, and I think we needed a bit more support from the government, especially as medics at the beginning. We were crying out for PPE, which is a protective equipment. And again, when the protective equipment came, there was a delay. And again, there were parts of the community staff who were actually seeing patients in the home environment, going from one house to another, to another, to another, really that could have been protected a lot earlier. But these were policies that were coming from higher up. But again, it wasn't, I'm not saying it's anyone's fault, because nobody knew how to handle these things. But if you're going to do something differently, there are some of the key aspects which actually going forward that we would need to pick up on.
Yeah.
Okay.
That was really interesting.
Yeah. I didn't know they stopped testing. I thought they were continuing testing.
No, so what they did, so initially the first thing in Germany and the UK, we started testing in the community. So we would test in the community. But then what they did at one point, if I can get my dates from this, so if I've got the dates in a magazine or a picture here, I've got the dates, in fact, I'll just get the date for you. So 12th of March, we actually abandoned contact tracing.
Oh,
Which
wow.
means we started doing it. Then 12th of March, just before everything started taking off, the UK stopped doing it. And they said, okay, we're only going to test the people within the hospital. And I think that was really the fact that they didn't have enough resources or equipment.
Yeah.
And I think that was one big key area. The other big key area that was a bit naughty of the government as well, this is my view, on the 19th of March, they graded the alert from 4 to 3. So by doing that, what they effectively did is that they said if you're on alert 3, the actual protective equipment that you need in the community for people that haven't got COVID, potentially, is less. So the danger that you've got here is that because a lot of people are asymptomatic, or there's a little window, you have a window where you've got no symptoms. And if those people potentially are spreading the disease, and then you get the symptoms, and that's when you want to trace. But then you've also got people who, for some reason, don't develop symptoms, but are still passing it around.
Yeah.
So I think the community tracing would have been important. But going forwards, I think this is something now that I think they've acknowledged, they've recognized, and this is where they're changing. And yeah, and going back to the homes, I think now all the homes have, again, locally have all been tested. And in terms of being tested, I think the staff are being tested and the homes are being tested as well.
Yeah.
As in, so the staff and the patients are being tested. That's what I meant, sorry.
Yeah, I think distribution of resources was a big thing that a lot of countries were going through, like figuring out where to send the supplies, where to get supplies. I think that was a big.
And I think the sad thing in life is that there's been a competition. But, you know, it seems like, I'm not sure, we've heard that it was different parts of America, different states are competing for the same resources. Because actually, I think one other thing that's been missing here is some sort of background guidance from somewhere. Because actually, what's happened is that when you've got 5 people competing for the resources, the price goes up. And and again, I think it's sad looking at that, the fact that, you know, that actually this was the issues and the cases. Because if you look at a Korea, like you look at a country, I think, like you're talking about internationally, South Korea, they've got a fantastic tracing policy and everything else. But then they're right next to North Korea, who are their friendly neighbours. So they've been through lots of different testing and programs to try and prevent things occurring. So they've got a different system and different way of looking at things.
Yeah.
But their contact tracing was superb.
Yeah.
So, if you don't mind, do you mind describing a little bit about the UK healthcare system? And then now that you've experienced this pandemic firsthand, what new takeaways do you have about the system?
Yeah, I think the UK, one thing, Hannah, even without being biased, I said the UK health system is fantastic.
It is. It really is.
Free at the port of call. You know, we have patients who are diabetic who we will supply all their medication for. So it's fantastic. Wow. So in terms of the level of care at the primary care level potentially, and at the hospital level. I think that the actual structure is great because it allows access to everyone for it, and there's more equality of access to the care. So that's the first thing. I think what had happened in this whole campaign, I think there's been neglect of basically public health and social care. So these are two organisations. Public health is basically looking at the big pictures, working with the councils and working at that sort of level. So general practice is working at a unit where we actually have 5,000 to 7,000 patients. We look after them, we give resources, we work with the nurses, we work with the community. And then you've got secondary care, which is a hospital-led care. So we have like a tiered system where you've got care within your own community and environment. Then we've got associated people that work with us that will see patients that are housebound, provide palliative care resources, provide respiratory resources, and all these other things. And then you've got another level of care, which is the hospital, which is when the patients become very unwell, need oxygen, need the ventilators, need further treatment, and that's the different levels of care. So those are the different sort of levels of care. But then you've also got social care. And then in this country, a lot of people have the right to either be looked after at home or in residential, what we call nursing homes. So a lot of these are state funded. So there are elderly people where they can't manage themselves at home or for whatever reason, they need nursing care or other facilities. So in that way, the care and everything is fantastic. And the ability and access to care is great. But in the context of what we've had with COVID, I think there are lessons to learn about where the resources could have been geared towards. And I think the dilemma is balancing what is needed from a political point of view and what is needed from a health point of view. But at the same time, all making sure that we're all going in the same direction. So does that answer the question really about how we do in the UK?
That was perfect.
And then another question is, after living in the center of a pandemic, how do you think the healthcare industry will change, if it will?
Okay, so I think the first thing is when you've had a crisis, I think the crisis is lots of bad things happen, but there's actually lots of opportunities happen. I think that's the way you've got to look at life here. We've got to look forwards. So in terms of living in the center of all of this, it's going to be nice not to live in the center of all of this, but there's some, it's like, there are some changes that have come out which have really been, I think, positive, and going forwards will be positive. And again, this is a personal reflection. My father was seeing a doctor, and I was talking to the doctor that saw him, and he was a neurologist, so he was a specialist that deals with the brain and things like that. So we'd seen him, and we were just chatting generally, and the first thing he said was that he felt quite guilty because he wasn't in that front line. He's been used to working very hard all his life. And all of a sudden, he didn't have the skills that fitted in with the front line, and he didn't have skills that fitted in the back line. So he was in a slightly grey area. But at the same time, he said that actually he got a bit of space. He got a bit of life in terms of he was less hectic and he was less pushed to do everything. So what I think this has shown is that we can actually do things differently. So from a general practice point of view, the positive here has been actually we were able to give all our patients their medications. We're able to review them. We still do childhood immunizations. So children are still coming in. We want to open up things. But all of a sudden, we've had to embrace the technology. So we can talk to people by, like, we're doing a Zoom conference today. For me, if you go to me 3 weeks ago, let's say a few months ago, and you asked me to do a Zoom call, I'd probably start getting the jitters and actually avoid everything to do it. But actually, we're having more communication like this. And this communication, ability to communicate has improved. And going forwards, I think we need to use that as well. And I think learning from this as well, in terms of using the technology, in terms of the apps that potentially they can use for contact tracing will be really good if we can use it. And I think structuring things such that patients have more access to us, but in different ways. So it's bizarre, but we've never been used to it, but we started e-consulting. So I walked into my surgery last Monday and about 40, 50 emails already there from patients who've been trying to get hold of me over the weekend. But on the first thing on Monday, I was able to process them. And they're designed such that they can ask us queries and we can direct it to different people. So we could direct it towards our pharmacist, we could direct it towards something else, but also it gives me the time to look things up or phone up a hospital colleague. And we're seeing lots of rashes. So again, people sending pictures of things, and for us it's just opened up a whole new avenue of actually allowing somebody to stay at home, go to work, go with their kids, but us giving them an answer and talking to them, say, yes, we've seen everything, this is what we advise. So I think going forward, there's some really positive changes there. The fact that the community has been so great to us and that unity is a very big positive change as well. So I think they're the things I think looking forwards, I think they're the things we should be taking forwards and working from them. But at the same time, acknowledging the fact that maybe things could have been done differently.
Yeah.
Yeah, I think the technological aspect and opening new ways for patient care is something that was really interesting that was spurred by this whole thing.
I mean, Singapore, they have like a
Great.
in Singapore, they have like an app that tells you if you're near a COVID patient. So
Yeah,
they've been like, my uncle goes for runs in Singapore's, and like if he sees that there's a COVID patient nearby, he'll change his route and come back home.
it's really interesting.
Yeah.
Okay, so but if I have that app where I'm working, every time I see somebody with a cough or a cold, I'm going to be in trouble. That's it. But no, you're right. You hit the nail on the head. I think that they're piloting an app here in Northern Isle of Wight, I think. For they're part of the UK are piloting some app, and again, it's quite clever because you've got the app which will effectively have a Bluetooth connection. So effectively, when you've got your contact tracing, it will help in the contact tracing because I may phone up Megan and Meg, okay, I'm sorry, you've got COVID. Okay, who are you in touch with over the last 2 weeks and how close were you? And you can give me a list. I can contact trace them manually like that, and that's what a lot of people are doing. But some of the apps, if they're used nicely, is that I've got my phone with a Bluetooth, and yes, I was walking down the street and Ishan passed me 2 weeks ago, and I've got COVID now, and maybe we need to contact Ishan because I was in I don't know in the restaurant with him for half an hour, or whatever it is. So the technology is going to be great, and actually, I think the other thing is it's just reducing that fear of technology, maybe from our end as
Yeah.
practitioners, doctors, and giving the patients the ability to use that technology because it's a two-way thing.
Yeah.
So our final question is, how do you think society is going to respond when everything begins to reopen again in terms of precautionary measures as well as other aspects?
I think people want to get back out.
Yeah.
And I think what
Yes,
we have to do is
definitely.
we have to think about how to get people out safely and in a way that they're protected. I think until we get a vaccine, there's going to be a bit of delay. And I think you've got all these trials. So the other thing I forgot to mention was going backwards is the other thing that would be quite good to look at in terms of retrospectively is that there are potentially lots of trial drugs. So when we've had previous pandemics of SARS and other issues like that, they've not been able to look at the research side of actually whether these drugs work or not. So I think retrospectively, that's one other thing that in the UK, our practice is involved in a couple of trials. It's called the Principles study and the Instinct study. So effectively, these are two trials where if patients come with COVID-like symptoms, we can now get somebody to take the swabs, not only for the antigen, but for the antibody blood test as well. And with the Principles study, it's a study whereby if somebody develops symptoms, they've got some trial drugs, which at the moment would be azithromycin, where patients develop symptoms and some are given azithromycin, some are not given azithromycin, and you can compare the two later. So that was going back to one of the other questions. But going back to your thing about society, I think the first thing is it's been a big wake-up call because actually the deaths have been X number. We've had previous pandemics where the deaths have been higher, but actually a lot of countries have been brought to a standstill in terms of the economics and everything else. So I think going forward, we've got industries like the food industry, etc., which is still being functioning. So I think society, the industry will learn from those people, number one. And in terms of society, I think there'll be a bit of caution and a bit of respect and maybe appreciation for the freedom that we have after having been locked up for such a long time and actually see relatives and all these things. In that respect, they'll be there. But I think there'll be a degree of fear as well. Until we've got a vaccine that actually gives safe treatment, there'll be fear because there are a lot of unknowns here. The unknown is that if you've had COVID, will you get it again? Can you get it again? When can you get it again? Will it be different? Will COVID be with us for now till whenever in the environment? And again, we're waiting for the vaccine to come out. So until we've got those safety nets in the background, it's going to be difficult. So in the UK, what they've done recently is they're opening up schools as one of their steps. So then the issue again that started off when you listen to all the news and the politics, the teachers are worried, wait a sec, I can't, a teacher has not been able to see her grandson or grandchild or her children, but is now having to look after kids that she has knowledge of but no relationship with. So what
Yeah.
is their risk? And what is the risk with these children coming out that have no symptoms? Do they spread it? Do they not spread it? The evidence is that they probably don't spread it as much. But again, if you're a child and you pass that COVID on to somebody else, one of the other issues in the background was this sort of Kawasaki, this sort of vascular problem that they're seeing in kids, not after they've got the initial diagnosis, but when they've actually recovered. And when they've recovered, for some reason, they've developed some reaction which nobody understands, and they just seem to go into this body shutdown when it's affecting the vessels. So again, there's that. So there will be a degree of fear, but again, maybe I'm overriding it because I have medical knowledge beyond that. But I think there'll be a sort of cautious welcoming to the fact that things are opening up. But I think we need to just monitor as we go along. And I think the government here is stating they're going to monitor this thing called the R number. So the R number, which means that the reproduction of the virus is such that it seems to be spreading to more people than they'd want, then things go backwards in terms of the shutdown and things like that.
Yeah.
So the answer is, yeah, it'd be nice to get out, enjoy the sun, see your friends and family, kick a football around or whatever it is that you enjoy doing. But at the same time, I think we have to get out some sort of normality. Again, going for a haircut. If you look at it, another thing, it sounds like a simple thing, but in the UK, the people that suffered the most were, in terms of as a profession, in terms of deaths, were hairdressers, taxi drivers, undertakers, social workers. So people working in those sort of jobs. If you're you're driving a bus every day, and you've got a lot of people coming for in the bus. There are lots of things like that. So I think things, without being negative, things will change. But I think it's important to monitor, and it's important for people to work together. But for people to work together, I think you need some trust, and the trust is in the people and the people that actually set the rules.
Mm-hmm.
And I think that is one big area that is important. So if you lose that trust, then it's difficult. But I think, as a very positive, the British government been very good about giving the rundown and saying this is what we're going to do, this is how we're going to do it, and they've been very clear about it. And if that carries on, that's good, and that's the positives of it, and we should work from there.
Yeah.
Yeah, I think there's definitely going to be mixed feelings about the reopening and people being able to interact more and see with each other.
Yeah.
Yeah.
Yeah, and people that have maybe not been used to working, maybe having to go back to work in an environment they feel is not as nice, but you have more people. I'm sure you have more people working from home as well. The fact that technology has allowed that as well. You can do your Zoom conferences, meetings with 20 people, and you don't have to drive here and drive there. Yes, so there'll be things will work differently. And I think we've got to, as you said, there are opportunities, and we've got to build on those opportunities. And while the vaccine is being developed in the background, get these things done.
Yeah.
I think that pretty much wraps it up, Dr. Thacker. Thank you so much for your time. We really appreciate taking the time out of your schedule to inform our listeners.
Thank you.
Yeah, thank you so much.
And if you listeners have any suggestions that you want a topic that you want Meg and I to discuss in upcoming episodes, let us know in the comment section below or email us at gmail.com.
Yep. We hope everyone's staying safe and healthy. And thanks for listening.